Welcome to the Med Spa Method. My name is Leslie Schweitzer, and I'm a doctorate-prepared nurse anesthetist and the owner of Real Aesthetics and Wellness. This show is your guide to navigating the med spa world with confidence. I'm going to talk about the treatments, the trends, and how to find a provider that you can trust. Because when it comes to your health, your face, and your results, there is a right way to do it. Hey, this is Leslie, and today I'm sitting here with a friend of mine, Shamiah Dekker, owner of Mauve Medical Aesthetics. And tell us a little bit about you and your spa.
Hi. So I am a certified registered nurse anesthetist like Leslie. So we started our spas around the same time, so we've become really close around that and just like-minded souls, I guess. Mauve Medical Aesthetics, I started with a very good friend of mine as well, Jenna DeVries, who is also a CRNA, and we provide laser treatments, tox, filler, microneedling, chemical peels, and Tixel treatments, which I think we're going to talk about today. So kind of all the basic stuff around aesthetics, and we try to be very research-based, and yeah, that's what we do here at Mauve.
Awesome. Well, I want to talk to you today about Tixel because it's something that I don't offer. So I have a lot of questions, especially when patients even come to me and say things that they've had done in the past. I'd like to be able to speak better to what a Tixel does. And right now, what I tell them is, well, my good friends have one. And if you'd like to have that treatment, I can send you to them. Otherwise, I have these things which act kind of similar. So let's get into it.
Yeah, so Tixel is similar to something like an erbium or CO2 treatment. It's similar in that it is a resurfacing technology or device. It stimulates collagen and elastin production and then resurfaces the skin. But it does it in a completely different, by a completely different mechanism of action. It uses heat versus laser energy. So we're not targeting pigment or water. We are simply using a titanium plate to stamp the skin to trigger those similar reactions, I guess, or similar endpoints. The two things that make it really different from an erbium or CO2 laser is that it can be done up to the eyelash. So it is FDA approved for treating dry eyes or meibomian gland dysfunction. So that's really an awesome factor for it also. And then what else? The other two things. Oh, so it also opens up the dermal epidermal junction for 8+ hours. So immediately following the treatment, we give exosomes, high quality exosomes to use so that your skin is really soaking that in. And that's something that the laser treatments don't offer. So we really love Tixel around here, and we have a lot of clients who are dedicated to it as well.
What skin concerns do you think Tixel is like the absolute best treatment for?
We love it for melasma because even though the heat is there and that can trigger melasma, it doesn't go to the depth that is required to trigger melasma. So we can treat melasma with it. Say that again.
Like what
other
skin
things?
concerns?
Oh yeah, so melasma is a big one. Definitely different, if you want to even out the tone of your skin is a big one. Fine lines and wrinkles because it's stimulating the collagen and elastin production. And then just the resurfacing aspect of it also is huge. So
how many sessions? Like how many sessions do you think somebody needs?
I would say initially I typically tell people 3 to 6 to get like to your base level of what your goals are. It can be different for everybody. So if you're 25 and you're coming to just keep up, maintain what your skin looks like, you can get it done 1 to 2 times a year. If you are 65 and you're trying to turn back time a little bit, then you're going to edge towards the 6 treatments. And I think that's really similar with any of the lasers or energy-based devices. It's going to take more to get you to where you want to be, depending on your skin health. If you have comorbidities, diabetes, or if you're a smoker, your healing time is going to be increased, and it's also going to take more treatments to get to your goal as well. So that's what I would say. I would space each of them by about 4 to 6 weeks if you're younger, but cell turnover rates decrease as we age. So if you are 50 plus, I would tell you to come every 2 months. I think that you're wasting treatments a lot of times if you do it before that 8-week mark when you have older or more mature skin.
Is the treatment comfortable?
Yes and no. We use numbing. So we use a lidocaine tetracaine, what's the word I'm looking for? Solution, numbing cream. Yes, a numbing cream. We leave it on for 20 minutes and that makes it more comfortable. Over areas of bone or thin skin, it does tend to be a little bit more uncomfortable in those areas. But we do our best to make it as comfortable as possible. The downtime is something also I would kind of lump in there. So downtime for Tixel, I would say, is like 3 to 5 days, whereas heavy CO2 treatments or heavy erbium treatments can last, 7 to 14 days, depending on how well your skin heals, as you know. So the downtime is less. The treatment is similarly uncomfortable as it is to the other kinds of lasers and things. So definitely with the numbing, it's still not something that you lay there and feel relaxed for. You're going to feel it a bit. You're going to feel really hot, like a bad sunburn for about 24 hours.
So how about, like you mentioned downtime a little bit, but like what is the post-care treatment like when you go home?
When you go home, we give you the rest of the exosomes. We want you to put those on every hour until it's gone because we really want those to soak up while the dermal epidermal junction is open. And then we encourage hyaluronic acid. We have an enzyme hydrogel that we put on. We also have one of our own products with a phytoserum that helps with calming after post-procedures as well. So we give you those 4 things, maybe some extras that are like tuned into what you are specifically working on. If it's melasma, we may do like tranexamic acid. We will customize it to your skin. But the exosomes are huge in those first few hours. The next few days, we encourage people, they can go back to their normal skincare routines, really. Just no exfoliation. We don't want to take off any of those mends, those little scabs that people get after even, I think, erbium laser as well. We don't want people to prematurely exfoliate those things. We want to let your body do the healing.
So I had one treatment with the Tixel, but like my memory of it is kind of faded because I think it was like 2 years ago, like shortly after you first got it.
Well, we should get you in here again for it.
We should. But that time was kind of fun because we treated my abdomen.
Yes.
You remember? And so I wondered, like, how often are you treating other areas of the body? I did like what it did to my abdomen. It was just,
we only did the one.
Intense.
And, yeah. I would say about the same every 8 weeks to get to the goal, your endpoint. So every 8 weeks, 4 to 6 treatments to help with things like scars or stretch marks are a big one that we've been treating too. So, but yeah, it's similar. I would say the 8-week mark. Yeah.
What kind of things would you tell somebody, oh, Tixel's not the answer for that particular problem?
Oh, let's see. Not the answer. Tixel's very, I think
it sounds so universal.
It is like a really good universal thing that like every person of every skin type can use, especially as a maintenance treatment. So what it would not be good for is hard for me to come up with, to be honest.
How about acne? Like, I feel like acne
is actually a really good one for it because that heat kills the acne. So it's not contraindicated for that. It is used for it. And a lot of times we can pair that with doing chemical peels, alternating between the two to really treat acne. So along with acne scarring because of the resurfacing aspect and the collagen stimulation.
Okay.
So
how about rosacea?
Rosacea also, we actually, no, that's perfect. We do like doing it with rosacea, but we do light settings so that it doesn't trigger any of those responses that rosacea can sometimes be really sensitive to.
Okay. What happens, like, in the summer? I tend to not do IPL treatments during the summer. Can you still do Tixel treatments during the summer?
You can. It makes it it's an awesome treatment because it doesn't target the melanin. So if you have had sun exposure, it's not going to target those areas. So, or in that way, as like a laser picks up on color or hemoglobin, and same with IPL, it picks up on certain things depending on um, which stone which crystal you put on it. But this does not have that light energy function. So it's safe even in the summer, although you will still have to put on SPF and protect your skin because your skin is sensitive after it's done. So
Okay. How about, when I plan my Tixel to come have with you, how much time do I have to prepare then? You mentioned, like, you can't exfoliate too soon, so how long do I have to wait before I can, like, resume my monthly facials?
monthly facials, and I would say wait at least a week because we want to make sure that your skin is healed from the Tixel. So a week at least for most people, and some people who may have delayed healing time, I would say 2 weeks out from that. Same with like if you're going to get your tox, I would wait 2 weeks before you go to get tox. Make sure that you're all healed up because how the medication disperses in your skin can be changed by the fact that your skin is freshly resurfaced.
Mhm.
Before your treatment, it's nice to talk with your provider as well, especially with discoloration or melasma. Sometimes pre-treating those things helps the procedure to maximize its effects. So getting on something like hydroquinone or very good skin products beforehand to prep your skin before you come in for even any a laser treatment or a Tixel treatment is recommended.
That was gonna be kind of my next question is, like, how do you plan this stuff with your clients?
Yeah.
Like, because you want them to obviously stay up on their maintenance treatments as well, like their monthly facials, or if they're a Botox client, you want them to still keep up on their tox, so where do you space that in between? You said maybe 2
Yeah,
weeks.
I like 2 weeks on either side of it, and definitely different people, their uptake of tox is faster for some, and some people take an entire 2 weeks. So I think saying 2 weeks between other treatments makes it more safe for everybody.
Okay. As far as going home with, like, that hot feeling on your face
Hmm.
after this heat treatment of
What?
sorts,
Yeah.
what do you tell people to
What
do
makes
for
it feel better?
Yeah.
Sit in a fan.
Okay.
If it's winter, roll your window down and, stick your face outside. No, but truly, part of the healing process and part of what makes it work is the cascade that happens from it. So we don't encourage people to take antihistamines or anything that would block these responses from happening because all of those things like ibuprofen, we don't want to actually stop that inflammatory response. We want it to happen because that's signaling to your body, um, hey, it's time to send more collagen here. We're creating all these micro injuries essentially. And if you block the response, you will get less of a result. So, kind of sitting with the discomfort is recommended, but using the products that we give you will help to diminish that discomfort. The hyaluronic acid, the exosomes, those things all help with the recovery time. Big thing with Tixel is you don't wanna trap the heat, and I think we do that a lot with erbium as well, but maybe not as, strict about. I don't know how your practice is, but just not trapping the heat with some of the laser post balms. So things like Aquaphor or really um, s thick
Like creams.
products, creams, are not recommended in the first 24 to 48 hours with Tixel. They're contraindicated, so.
That's quite a bit longer. Cause like, what I would tell people is when your face doesn't feel hot anymore,
Mhm.
you can put creams on.
And I feel like people are just more hot with Tixel for longer than they are with erbium treatments, as from, like, our experiences with it, at least.
And when you treat somebody, like, kinda going backwards to melasma, I'm just having this thought, like, when that pigment is hit with the Tixel, does it become, like, darker and flake off, kinda like with a chemical peel? Or what does the peeling process look like for those people?
Occasionally, it will kind of come to the surface and look worse before it looks better, because that has to kind of work its way out, and that is similar to other things. But I think it's a little bit less. I think it's more of it that it's blocking the mechanism of action for it to be created versus pulling it out of the skin. So it's more of a block than it is like pulling like a chemical
Sure.
peel or like IPL even. IPL tends to bring it to the surface and then is it
It can come off.
exfoliates,
Yeah.
yes.
So would you ever pair this with something like a microneedling?
We don't we would not pair it with microneedling. Occasionally, if somebody is really pretty tough, we might put on a light chemical peel immediately after, but that's uncomfortable because your skin is, like, open and ready to take it in. So it is uncomfortable. We would not do a strong chemical peel, but a lighter one is sometimes beneficial right after. So that's the only thing that we would typically pair it with in the same, um session. Otherwise, we tend to wait and do things alternating, every 3 to 4 weeks. If they wanna come in 3 to 4 weeks later and get a chemical peel, that's fine. Microneedling is a lot of the same mechanism of action, like, with the micro injuries. So, I always call Tixel, like, microneedling on steroids. Um and how it kind of functions and getting things deep into the skin, the dermal epidermal junction, getting things deep into the skin with microneedling. It's similar to what we're doing with Tixel, but we get deeper and we get more of a response. So I wouldn't pair it with microneedling because we're already doing that work. So I like to do something that works on another spectrum, like chemical peels.
Okay. So I think I've answered all of the questions that I have.
Yeah.
Do you have anything that like clients come in and they're just misinformed about and you'd like to just you
I
have to straighten it out for them or
So I like to make a big point to say that this is FDA approved to treat dry eyes. So if you have a diagnosis from your ophthalmologist or a physician that has this on record, some people can get it covered by insurance. So that's a huge thing as well. So the fact that we can treat onto the eyelids, that is like a double whammy. You get to treat your eyelids and the appearance of them, and then on top of it, you get to treat a one of your diagnoses that you may have been struggling with or using eye drops with for a long time. That's huge. So that is a big thing. Misconceptions about Tixel, I think just that it's like a laser when it's really truly a different mechanism all around. Like we are using a titanium plate, it heats up really, really hot. And as long as your skin is dry, we're creating those micro injuries. So it's very different from a laser, even though sometimes the end result is the goal is that kind of similar with the resurfacing and the collagen stimulation. So um
that
yeah.
actually did make me think of another question.
Yeah,
When you do the treatment, do you just always do kind of like top of the hairline, down to the collarbone, or do you like how do you price it out? Do you do
sure.
just the eyes, just the neck?
Typically we will do full face and neck. That's our typical treatment. And then because of the fact that it is FDA approved for the eyes and the eyelids and the meibomian gland dysfunction, we do offer just an eye treatment where we kind of do like, I don't know, the band across the eyes and help so that people can get a more affordable treatment for something that is a diagnosis. So usually it's just eyes, or it's full face and neck. Mostly because I just don't like leaving the neck undone when
Yeah. Yeah.
so we just bundle that all in and you have to get it all. If you come in with a huge plight that you only need your face done versus, face and neck, then we'll find a way. But
Mhm.
we encourage face and neck to get done together.
Or how about like décolleté? Can you just be like, oh, okay, I'll add décolleté,
Yes.
or is that too much for someone to go through with in one day?
Nope, you can do all of that together. It's less common to have it done, but you can do all of them. And we would add um, just one area because you can have this done for like scars or your stretch marks as well. So that's priced just like the eyes in a way. It's more of like a time-based treatment in those scenarios.
Okay. So since we're talking about more expensive treatments,
Yes.
what are some ways that you help your clients save money to be able to afford these more expensive treatments?
We have a membership program, which I encourage all of our clients who are getting regular treatments, whether it be tox, filler, chemical peels, microneedling. If you're coming into us every 3 months, we like to encourage you to do that because, like at the dentist or like getting your hair done, I mean, if you go to the dentist and you only go every 6 months, and you never brush your teeth in between or things like that. We want to keep up with all of the treatments. You can't just get one and expect it to last you for the rest of your life or to turn back time completely in one treatment. So memberships, it is a certain amount every month. We do 150 every month, and that money goes into a bank so that you're saving up money for each of your treatments, and that goes towards each and every treatment you get done. And we reward you in that way with 10% off of services, 20% off of products, kind of encouraging you to just keep up with it. And that way it helps manage as well because you're not dropping $1,200 plus in one sitting. It's hopefully building over time and helping along the way.
I like to talk about memberships in a way that it's your money anyways. It's kind of like layaway. I'm kind of just holding it aside for you.
Yes.
And I also like this idea that it can fly under the husband radar
Yeah.
because like your husband's not going to notice as much this $150 every month being spent. And I mean, I say that with love towards
Yes.
our husbands
Yes.
because they don't always, and I'm generalizing, of course, but they don't always value our appearances as much as women sometimes do. And so, I mean, there are men out there, of course, that value their appearance,
Yes.
but oftentimes men value their golf clubs or their fishing boat, but they don't value your smooth forehead or,
Yep.
like not having to put makeup over your melasma. And so, I like to talk about it that way because I feel like a lot of women can relate to wanting to like fly under the husband radar.
Yep.
Just like you're going to spend it anyways and they know it, but it's easier for them to swallow when it's $150 a month instead of one big payment, every 3 to 4 months.
Exactly. Yep. So
You
it
just want the
helps.
benefit of discounts along with it.
Exactly.
Yeah.
So that's kind of what we do to encourage, I guess, compliance and like more frequent things and getting yourself. I mean, tax only works if you're coming every 3 to 4 months. If you come once a year, it's really not as effective. So,
Sure.
yeah.
Yeah.
Same with all of most skincare products and
Right.
sessions.
You
Yeah.
need consistency. So,
Yeah.
yeah, and you're getting rewarded for your loyalty, like to the medical spa. This way, you, the owner or like ourselves, we know that our clients are going to be loyal to us, and we're happy to reward them with discounts because we know that they're not going to hop around all over the place, which is really hard to manage someone's care. It is aesthetics care
Yeah.
when you don't know what they were injected with last time or what chemical peel they had last time because they're trying out all of the local areas. So we're just rewarding them for consistency and for their loyalty to us. We're
Yeah.
just giving it back. So I do like that. I love that about memberships. Yeah. So, is there anything else you want to add or should we just get to it next time?
Yeah, we can chat more about the next thing on the next episode. And yeah, we love Tixel and we love memberships around here. So
Good. Well, thanks for chatting with me. We'll see you guys later.
thanks for having us.